Hi everybody, let's study skull anatomy today. Alright, so let's start. Alright, so let's first study bone surface markings because we will be focusing on that when we study about the bone skulls, right? This, the bones of the skull, sorry. Alright, so depressions and openings, sites allowing the passage of soft tissue. So that's nerves, blood vessels, ligaments, tendons, or formation of joints. The first is fissure. A fissure is a narrow slit between adjacent parts of bones through which blood vessels or nerves pass, right? For example, superior orbital fissure of sphenoid bone, right? What is a foramen? Foramen is like a hole, right? Opening through which blood vessels, nerves, or ligaments pass. Optic foramen of sphenoid bone. What is a fossa? Fossa is like a trench. It's a plural for fossae. Shallow depression. So fossas are like shallow depression. Coronoid fossa of humerus. What is a sulcus? Sulcus is equals to groove. Furrow along bone surface that accommodates blood vessels, nerves, or tendons. Intertubercular sulcus of humerus, right? Meatus is a passageway, all right? And the plural is metae, right? Tube-like opening, all right? External auditory meatus of temporal bone, the way to the middle ear, basically. So we learn fissure, narrow slit between adjacent parts. We learn foramen, opening through which blood vessels, nerves pass through. Fossa is a shallow depression. Sulcus is a furrow along bone surface that accommodates blood vessel, nerve, or tendons. So that's a sulcus. It's a furrow. Meatus, it's a tube-like opening. All right. What is a condyle? Okay, condylus equals to knuckle. Large round protuberance with a smooth articular surface at the end of the bone. Lateral condyle of femur, right? Facet, smooth, flat, slightly concave or convex articular surface, right? Superior articular facet of vertebrae, right? Head, usually rounded articular projections supported on neck. Example is head of femur, all right? So head is usually rounded articular projection supported on neck, right? Processes that form attachment points for connective tissue, crest, right? Prominent ridge or elongated projection, iliac crest of hip bone. Epicondyle, typically roughened projection above condyle. Medial epicondyle of a femur bone, right? Line or linea, right? We usually say linea aspera, right? So long, narrow ridge of border, less prominent than crest, linea aspera of femur. Spinous process, sharp, slender projection, spinal process of vertebrae. What is a trochanter? A trochanter is very large projection, a greater trochanter of femur. Tubercle, variably sized, rounded excuse me. A tubercle is like a knob, but it varies in size, but it's a rounded projection. Greater tubercle of humerus. Tuberosity, variably sized projection that has a rough, bumpy surface. So, ischial tuberosity of a hip bone, right? All right, principal foramina of the skull, carotid, petrous portion of temporal bone, internal carotid artery, sympathetic nerves for eyes. So, which structures are passing through which foramen, right? All right, we just learned foramen is like a passage for soft tissues, nerves, arteries, vessels, etc., right? Hypoglossal canal. Hypo means under, glossus means tongue. Superior base of occipital condyles. Hypoglossal, 12 nerve branch of ascending pharyngeal artery. Yes. Infraorbital. Infra means below. Inferior to orbit in maxilla, right? Infraorbital nerve and blood vessels branch of maxillary division of trigeminal nerve, right? That's what it passes through infraorbital foramen. Jugular. Juggle means throat, right? Posterior to carotid canal between petrous portion of temporal bone and occipital bone. Internal jugular vein, glossopharyngeal vein, the vagus, and accessory nerves, right? Lacerum, lacerated, bounded anteriorly by sphenoid bone, posterior by petrous portion of temporal bone, medially by sphenoid and occipital bone. So that's lacerum, lacerated, foramen. Branch of ascending pharyngeal artery passes through lacerum. right? Magnum means large. Occipital bone. Medulla oblongata, just remember the name. Magnum and medulla oblongata, and its membranes, meninges, accessory nerve, vertebral, and spinal arteries, right? Mandibular, mand is to chew, right? Medial surface of ramus of mandible, that's the location. Inferior alveolar nerve and blood vessels pass through the mandibular foramen. Mastoid, mastoid is breast-shaped, right? Posterior border of mastoid process of temporal bone, that's where the mastoid foramen is, right? Emissary vein to transfer sinus, branch of occipital artery to dura mater. All right, so you can see that the existence is on a very broad range, right? Mental, ment is chin, right? That's where we have mentalis. Remember the muscle that I taught in a different video. Inferior to second premolar tooth in the mandible is where the foramen is. Mental nerve and vessel. It's like a little hole, right above the mentalis. All right, olfactory, to smell. Cribriform plate of ethmoid bone, olfactory nerve, right? Optic equals to eye, right? Between superior and inferior portion of small wing of sphenoid bone. Optic nerve and ophthalmic artery passes through optic foramen. Ovale, greater wing of sphenoid bone, mandibular branch of trigeminal nerve. Rotundum foramen, junction of anterior and medial parts of sphenoid bone, right? So that's mandibular branch of trigeminal nerve, right? Sorry, maxillary branch of trigeminal nerve. Stylomastoid, between styloid and mastoid process of temporal bone. Facial nerve, stylomastoid artery. One is facial nerve, another is stylomastoid artery. Supraorbital, supra is above, supraorbital margin of orbit and frontal bone, right? Supraorbital nerve and artery. The best part to remember all these is understand that remember the location. Your location is like a street. Where do you have this? It is between a 38th and 70th street, and what passes through it. So are all these that can pass through it. If you try to work, your logic out, I think remembering it's very easy. For example, infraorbital foramen. Where is this hole located at? It is inferior to orbit in maxilla. So you can consider maxilla as a location, maxilla as a street. Where is it? It is inferior to the street of maxilla. Okay, and what kind of cars can pass through? Infraorbital nerve, blood vessels, branch of maxillary division of trigeminal nerve. So this can be a policy or like a car or like a truck that can actually pass through this particular foramen, right? So this particular hole, yeah. So if you try to remember it that way, I think it will be very much easier for you, right? All right, cranial nerve. No, the best way to remember the cranial nerves, O, to touch and feel very green vegetables are, right? So olfactory nerve, special sensory, that's olfaction, smell, that's a principal function. Optic is number 2, special sensory, vision and sight to see. Oculomotor third is a motor nerve, movement of eyeballs and upper eyelid. Autonomic motor components which have adjust lens for near vision accommodation and constriction of pupil, right? Trochlear nerve, number 4. It is motor somatic, which means movement of eyeballs. Trigeminal, it's mixed sensory and motor. This one's branchial. Touch pain, thermosensation from scalp, face, and oral cavity, including teeth and interior 2/3 of the tongue, right? Trigeminal, so you eat something, it's super hot, you're drinking a hot coffee, that's where the trigeminal nerve will come into picture, Motor branchial, chewing and controls middle ear muscle, right? The motor branchial. That's why sometimes we chew, we can actually feel it in our ears too, right? Alright. Abducens nerve, right? Motor somatic movement of eyeballs, facial, mixed sensory, motor autonomic and branchial. Taste from anterior 2/3 of the tongue. Touch pain, thermal sensation from skin, external ear canal, right? All right, so touch pain and thermal sensation from skin in external ear canal. That's the facial nerve, all right? Motor branchial control of muscles of facial expansion and middle ear muscle, right? Because that's when you have Bell's palsy, that's when the facial nerve is impacted, and you'll see their muscles will be, there is no way facial nerve will be able to give, any kind of innervation to the muscle, right? All right, especially the buccinator muscle. Right? Motor autonomic secretion of tears and saliva. Facial nerve is also providing motor, one of the components motor. Vestibulocochlear is special sensory hearing and equilibrium. Glossopharyngeal is mixed sensory taste from posterior one-third of the tongue. Posterior one-third at the back of the tongue. Proprioception is some swallowing muscles. Monitors blood pressure and oxygen and carbon dioxide levels in blood. Touch, pain, and thermal sensations from skin of external ear and upper pharynx. Assist in swallowing and secretion of saliva. Okay, so there you go. That is your glossopharyngeal, right? Was green. I had one more, and this is it. Sorry, my bad. So vagus nerve, mixed sensory, motor autonomic, sensory taste from epiglottis, proprioception from throat and voice box muscles, monitors blood pressure and oxygen carbon dioxide levels in blood, touch, pain, and thermal sensations from skin of external ear, sensations from thoracic and abdominal organs, swallowing, vocalization, and coughing, motility and secretion of GI organs, constrictions of respiratory passageways, decreases heart rate, right? Movement of head and pectoral girdle, speech, manipulation of food, and swallowing. All right, what kind of arteries, pass through the skull? These arteries branch out from the common carotid arteries in the neck and supply blood to the front of the brain, the ICA. The ICA is divided into the middle cerebral artery, MCA, and anterior cerebral artery, ACA. Vertebral arteries. These arteries supply blood to the back of the brain. The right and left vertebral arteries join in the skull to form basilar artery. Right? So vertebral arteries, these arteries supply blood to the back of the brain. Why? Because the vertebra is on the back. Right? The right and left vertebral arteries join the skull to form the basilar artery. Right? So right and the left vertebral arteries. Circle of Willis. This anatomical structure connects the anterior and posterior circulations of the brain. It provides collateral flow to affected areas if any arteries becomes incompetent. So this circle of Willis is more like a contingency, right? So if any of the arteries is not functioning, then this provides a collateral flow, right? Other cerebral arteries include anterior choroidal artery and posterior cerebral artery, right? So as you can see, this is the ophthalmic artery providing blood supply to this area, because it helps in seeing, right? Anterior cerebral artery. This is the anterior cerebral artery. This is the middle cerebral artery. This is the posterior communicating artery. Posterior cerebral artery is not shown, but this particular artery is posterior communicating artery, which means it communicates with all this area. Internal carotid artery. There you go. This is the internal carotid artery, a branch of common carotid artery in neck and supply blood to the front of the brain. Right? So this part. All right. Cranial bone and suture mnemonic. 8 osseous parts from the skull. All right. So our skull has 8 cranial bones and 14 facial bones. Right. Let's start with cranial bones. Ethmoid, occipital, a pair of parietal, frontal, a pair of temporal, and sphenoid bone, right? As you can see, number 1, frontal. This is the frontal area. This is a squamous area, right? Sphenoid bone. This particular bone here is a sphenoid bone in pink color. Ethmoid bone right here is the red colored ethmoid bone. This is the occipital bone, right? This is the temporal bone. This area is orange, is temporal bone. This big area, okay, it looks like a map of Canada, but it's just me. Parietal, this particular area is the parietal bone. There are two pairs, one on this side and another on the other side. Okay, then that's how we have temporal bone, one on this side and another on other side, right? Temporal bone looks more like a wall, right? Walls on both the sides of something, right? Okay, so this is the anterior view. Frontal bone. Human anatomy is all about familiarization. So if you keep looking at pictures again and again, you will have location set in your mind. It's like looking at Google Maps, and then eventually where your college is, or where the hospital is, or where your friend's house is. Something like that. All right. So this is the frontal bone. This is a frontal squama. It's a flat area. This is a parietal bone, right? I told you the parietal bone is like a wall on both the sides. This is a supraorbital notch, this particular part, right? This is the squamous suture, right? When we talk about sutures, sutures join different parts of the cranial bone, right? This is the orbit, this particular area between your eyes, where you put like a mascara, and this is like a whole area, right? That's like the orbit. That's the ethmoid bone, like we discussed. This is the palatine bone. This particular area is the palatine bone. This is lacrimal bone. Lacr means tears, and this lacrimal bone, that's where you cry and the tears will appear, right? This is zygomatical facial foramen. This is a foramen. This is zygomatic bone, right? Whenever we apply blushes, we usually apply blush right here, right? This is like a cheekbone. That's where you apply most of your blushes, right? So if you're, let's say, you want to go for a party, that's where you would apply a blush, right? Oh, well, at least those who like to apply, right? Perpendicular plate of ethmoid bone. This particular is the perpendicular plate of the ethmoid bone. This is this part, right? Inferior nasal concha. This nasal concha is right here. It actually looks like a conch if you observe it, right? This is Vomer, V-O-M-E-R, Vomer, right? This is the mental foramen. This is where mentalis muscles are. This particular foramen, what is a foramen? It is a passageway, right? We learned just now. Vessels and arteries pop out, nerves pop out and provide innervations, provide blood supply, right? And it's a mental foramen. What is this? This is the mandible, right? The perfect jawline, right? So that's the mandible. Alveolar process of the mandible. This is the alveolar process. This also is the alveolar process, right? This is the alveolar process. This is maxilla. Maxilla. Everything in yellow is the maxilla, right? As you can see, it covers most of your face, right? So it has a very strong facial aspect to it. Infraorbital foramen. That's infraorbital foramen. That's the middle nasal concha. This particular is also a concha. This is the middle nasal concha. This is the inferior orbital fissure. That's the nasal bone. That's a sphenoid bone, right? And that's the temporal bone. This particular is temporal bone. Superior orbital fissure. This is a superior orbital fissure. Optic foramen canal. This is the optic foramen canal. Supraorbital margin. This particular is a supraorbital margin. Supraorbital foramen. Okay, supraorbital margin. This particular is our supraorbital margin. This is the supraorbital foramen, right? Earlier we saw a notch. This is a foramen, right? It's a hole. This is coronal suture, right? This was your anterior view in the front, right? Let's look at the inferior view. Let's say you have a skull in your hand. You're looking at it from the down, like this. The occipital condyles of the occipital bone article with the first cervical vertebra to form the Atlanta occipital joint. Right here, it gets stuck. That's where it is. It's, Incisor teeth. These are incisor teeth. That's where we actually chew. That's where the teeth mainly we use to whistle, right? Maxilla, incisive foramen, palatine process. This is a palatine process. This is a foramen, right? Incisive foramen. This is zygomatic bone, palatine bone. This is pterygoid process. We didn't talk about it. As you can see, you look at it from below, but this is also a sphenoid bone. Pterygoid process is a part of sphenoid bone. This is foramen lacerum, right? We just had a chat about foramen lacerum. This is articular tubercle. That's a styloid process. That's external auditory meatus. What is meatus? Or metae? Remember the plural of meatus? A passageway to the ear canal, right? We just learned. Stylomastoid foramen. Yeah, mastoid process is a mastoid process. That's foramen magnum. That magnum, right? Magnum is large. Foramen. So this is a foramen. It's a hole. Mastoid foramen, a hole. Parietal bone, and that's a lamboid suture. That's external occipital protuberance. What's going on? Okay. Inferior nuchal line, that's the inferior nuchal line. Superior nuchal line. Temporal bone. Occipital condyle, jugular foramen. That's a carotid foramen. Mandibular fossa, foramen spinosum, foramen ovale, sphenoid bone, and vomer. Right? This is the zygomatic arch. As you can see, it connects the two. This is zygomatic arch. And that's a zygomatic bone, this particular bone, but the whole thing that connects the two, that's called as the arch. I don't know what's going on with this particular thing. Okay, let's start with ethmoid bone. The ethmoid bone is a vital part of the skull's structure, helping to form the orbit, nasal cavity, nasal septum, and the floor of interior cranial fossa. All right, so it provides structural support. It's a vital part of skull's structure, helping to form the orbit. Right, the orbit. We saw what the orbit area is. Nasal cavity, nasal septum, and the floor of interior cranial fossa. Right, we saw what a cranial fossa was. Right, it kind of looks like this particular pasta, tortellini, which I personally love tortellinis, right, with some feta spinach cheese inside. Protection is ethmoid bone protects the eyeball and resists the fractures in the medial wall of the orbit. Sense of smell. The cribriform plate of the ethmoid bone allows the olfactory nerve to pass through from the nasal chamber into the skull, enabling the sense of smell. All right, so cribriform plate of the ethmoid bone allows the olfactory nerves. It also participates, right? That's the middle nasal concha. That's superior nasal conchae. That's crista galli. That's a crista galli. Perpendicular plate. This is a perpendicular plate. This is where the ethmoid bone is, right? As you can see, this particular, so that's middle nasal, right? That's a superior nasal, right? Okay. Air conditioning. The ethmoid bone directs and conditions inhaled air from the nostrils to the nasal cavity and then to the lungs. So increased surface area of ethmoid bone helps to warm and moisten the air. The size of the air pockets within the ethmoid bone changes throughout the life, which affects an individual's voice. So the size changes. I'm not sure if you remember one of the scenes in the movie Jurassic Park, I believe 1 or 2, right, where they actually found the little bone, from inside of the dinosaur, where they actually use it to create a voice of the dinosaur, and they did it very perfectly. So what they were actually doing was picking up one of the bones inside. There's a very good chance it would have been the ethmoid bone. Right? The size of the air pockets within the ethmoid bone changes throughout life, which affects an individual's voice. Right? Ethmoid bone is light, sponge-like bone located in the center of the skull between the eyes. It's made up of 3 parts: a cribriform plate, the ethmoidal labyrinth, and perpendicular plate. Right? We just saw, right? This is the labyrinth that they're talking about, the labyrinth. The maze-like labyrinth. Why do we have a maze-like labyrinth? Why? Because they just cleared the size of air pockets, right? That's why you have air pockets in the AC, right? There you go. And like they're also helping inhaled air from nostrils to the nasal cavity. They may have a very important role in purification of the air, right? So ethmoid bone helps with the process. Frontal section through ethmoid bone, right? What is a frontal section? Right? The crista gili, ethmoidal cells of ethmoidal sinus, lateral mass, superior nasal concha, middle nasal concha, and this is perpendicular plate. We just learned what that is, right? So this is how the bone is actually placed inside your skull, right? It looks like a trident placed inside your nose. It kind of looks like this particular flower. It's just stuck inside your nose, right? And it's exactly why it plays a very important role in olfactory. Well, because when you smell, flowers, that's where it hits up, right? And it looks like flower too, right? So this particular area, as you can see, is crista galli. That's a right orbit. That's a lateral mass. Perpendicular plate, the straight thing. The stalk is the perpendicular plate. That's middle nasal concha, that's inferior nasal concha, and this is Vomer. V-O-M-E-R, Vomer. Right? This is a frontal view, and this is view, right? This is the frontal section of the ethmoid bone. As you can see, it looks very unique. This particular area is the ethmoid bone. Plays a very important role, right? Occipital bone, right? So this is sagittal sutures. We will be studying sutures at some point during this class. This occipital bone, that's a lambdoid suture. These are sutural bones. As you can see, they are connected together. That is the external occipital protuberance, superior nuchal line, inferior nuchal line, foramen magnum. So this is foramen magnum. That's the inferior nasal concha. Hard palate, horizontal plate of palatine bone. That's the palatine process of maxilla. This particular is a palatine process of maxilla. It's mandible. That is again, this is Vomer. Occipital condyle. So this is the occipital condyle. Styloid process. Mastoid. Anything that's protruding outside will be considered as process, right? We have spinous process in our vertebrates, right? So that's how it is. We have transverse process, right? Anything that sticks out mostly is a process. Temporal bone, that's external occipital protuberance, and occipital bone. This is what you call a sagittal suture, right? So remember, these are two parietal bones. Sagittal suture connects the two parietal bones. Sutural bones, these are also connected to each other. That's the occipital bone. This is a lambdoid suture connecting the parietal, to the occipital bone, right? To the frontal area. Alright, so occipital bone, protecting the brain. The function is protecting the brain. The occipital bone protects the cerebellum and the occipital lobes of the cerebrum. If you see it, it looks like an inverted shell, right? This, right? Occipital bone provides attachment for several muscles and ligaments, connecting the brain to the spine. The occipital bone contains a hole called foramen magnum. Remember, we talked about our foramen magnum. It was right here and it connects to the vertebrae, right? As you can see, it just sticks it inside, right? Which allows the medulla oblongata to connect the vertebral column. Helping with the movement, it helps with the movement. Occipital bone helps with body movements, flexibility, stability, and balance, right? Allowing the head to rotate. Occipital bone allows the head to rotate. The occipital bone is flat, trapezoid-shaped bone located at the lower back of the cranium. It's covered by the scalp, which consists of 5 layers, right? Alright, parietal bone. So I kind of had this really weird picture of parietal bone. If you look at it, parietal bone, it looks like a half-shaved head. So that's what it is. Alright, so coronal suture. This is a coronal suture, and this is a parietal bone, right? So as you can see, it's a half-shaved haircut. Alright, this is temporal squama. This particular bone in pink is called a parietal bone, right? Alright, so this is a parietal bone. As you can see, it covers the side of the area. Protecting the brain, right? Parietal bones protect the brain, especially the parietal lobes, from blows to the top and sides of the head. That's true. It's not only the top, but also the side of the head. Forming the skull, the parietal bones help shape the head and form the cranium or the brain case. It's creating a case. You know how you would have cases for pens, like that. Limiting swelling, parietal bones help limit swelling caused by bleeding, infection, or increased cerebrospinal fluid. Protecting a newborn's brain. In newborn, the parietal bones, along with sutures and fontanelles, protect the brain while allowing for growth. The bones are softer and more moldable than an adult, which allows baby's head to fit through the birth canal, right? So when the baby crowns, it can fit through the birth canal, and this is exactly why is much more softer, right? So let's say if a baby is born, the head is a little softer. You can actually massage it and give it a perfect shape. That's what most of the NICU nurses actually do when they provide services like that, or midwives would do it, especially when their head is not in proper shape. It's times babies are born with bumps, right? Or their left side is more grown over the right side. Things like that. If it's not a genetic issue, then it can be a formation issue, and you can easily mold it. All right. The parietal bones are a part of the skull base and the calvaria or the skull cap, right? They're a part of skull base. Sutures. What are sutures? All right. So this is the anterior of the skull. This is zygomatic bone. This is a frontal bone. As you can see, this is called coronal suture. This particular that connects, the frontal bone and the parietal bone, that is a coronal suture. This in the middle, it doesn't say mid-sagittal, but consider it to be a sagittal suture, right? Parietal bones, these two are parietal bones. This is a sutural bone. This particular little thing, this is an occipital bone, right? So as you can see, we have different kinds of suture. One's a coronal suture, one's a sagittal suture, and this is sutural bone. But this is the anterior view, as you can see from right above, right? All right, so we'll see more sutures, right? Coronal suture. This is a rhomboid suture. That's occipital fontanelle. This is frontal fontanelle, right? Coronal suture, sagittal suture, rhomboid suture. Cranial sutures are sutures of the skull, are fibrous bands of tissues that connect the skull bones and appear as thin, intricate lines. All right, so these are cranial sutures. They're thin, irregular, tightly twisted lines that interlock the bones, unite the bones, strengthen the skull, and allow for the bone expansion. Right. During embryonic development, it develops. It's 3 week to 8 week. That's when they form sutures. Right. Most sutures ossify by age 20. All right. So they're done growing by age 20. In newborns, the sutures are wide and allow for slight movements during birth. The diamond-shaped space on the top of the skull and the smaller space further back are called soft spots. All right, so this particular, the red ones are called soft spots, right? Or fontanelles. These soft spots are normal for infants, but abnormally large fontanelles may indicate a medical condition, right? So that's how you know the baby has a medical condition. Why are they so large? Between 12 and 18 months, they actually close. The anterior fontanelle is the largest fontanelle and closes by 12 or 18 months. A sunken anterior fontanelle can indicate dehydration, while a bulging anterior fontanelle indicate increased intracranial pressure or meningitis. An inflammation of meninges is meningitis. All right, so sutures are like this, dog with harness. They contain the dog in it, so that's what it is, and allow them to grow, but it's also containing it, tightening all the bones together, saying you can grow, but you can't run away, like that. All right, so anterior fontanelle, this is anterior fontanelle. This is a frontal suture in the middle. This is the metopic suture, especially here. It connects this part and the nasal part. Intermaxillary suture, right? Especially right here, right? This is intermaxillary suture. It connects both the pyramids of maxilla, right? Like I told you before, I showed you this is your maxilla, and this is where it connects it. It's saying that we have to stay connected. 2 pyramids. 1, 2, and you connect it in the middle, right? Zygomatic maxillary suture. So this is a zygomatic maxillary suture. Why? Because it's connecting the zygomatic bone and right here, maxilla, right? So it's connecting it. Like, you know what? We have to stay connected or else our face will fall apart, right? Imagine not having this suture and this muscle will be floating and this bone will be floating. That's not how it works, okay? All right, so. Okay, so this is the frontal, all right? Frontal bone. This area in blue is the frontal bone, all right? So remember the girl with the umbrella? So that's exactly how the frontal bone is. It protects the front part. The frontal bone looks like a shell-shaped bone, right? Forming the forehead region of the skull with a smooth covered surface that extends above the eyebrows and forms the roof of the eye sockets. Essentially, its bony structure of your forehead appearing as a single unpaired flat bone with a slightly concave inner surface, right? The shape is ball-shaped or shell-shaped, right? Forehead. I personally make it look like an umbrella because the main function of front bone is to protect, right? Location is forehead. Parts are squamous part forehead and the orbital parts, roof of eye sockets. Notable features, supraorbital bridges, bony bumps above the eyebrows, and that's where the notable feature is. The frontal bone has several functions, including protecting the brain. The frontal bone is a part of cranium or brain case and protects the brain from injury. The CSF, cerebral spinal fluid, cushions the brain between the frontal and the meninges, which are padded layers that surround the brain, right? So that's how a frontal bone is protecting us. You know, it's surrounding us with a pad. Supporting head structure. The frontal bone supports the nasal passages, eyes, and frontal sinuses. It also helps give shape to the skull and supports muscles in the head. Creating the forehead's curvature. The frontal bone gives the forehead its smooth curvature, forming skull cavities. The frontal bone helps form the orbit and the anterior cranial fossa. Containing stem cells, the center of the frontal bone contains stem cells that develop into RBC, white blood cells, and platelets, right? So it forms skull cavities. The frontal bone helps form the orbit and the anterior cranial fossa. Containing stem cells, the center of the frontal bone contains stem cells that develop into RBC, white blood cells, and platelets. Facial architecture. The frontal bone is the key to facial architecture and helps transition between facial skeleton and the cranium. All right. The frontal bone is key to facial architecture and helps transition between facial skeleton and the cranium. All right. So this is the temporal bone. All right. So temporal bone are on the side. This is the temporal bone. And temporal bone is more like a wall on both the side. They come in pair, number 2, right? Just like parietal bone, they're number 2, right? This particular area is the temporal bone. You know, it contains stapes, mollies, and incus. All right, so temporal bone looks like this chicken, right? As you can see, this chicken with a thumbs up, right? Right here. Not temporal, parietal bone. Temporal bone. So this is temporal bone. That's how it looks like. It looks like a little chicken. All right. It has a zygomatic process. As you can see, this is a zygomatic process, and this is the styloid process. This is the tympanic process. This particular is the tympanic process. Any type of protrusion should be considered as a process. As you can see, there's a little protrusion here. This is the squamous area. This particular area is the squamous area. And this particular area is petromastoid. This particular is petromastoid. Right? So if you see this chicken, it is perfect in shape of a temporal bone. The largest part of temporal bone, the squamous, is flat plate-like bone, right? That forms the lateral part of the middle cranial fossa. The outer surface is convex, right? It looks like a little cave. And the inner surface is concave. The inner surface is concave, whereas the outer surface is convex. The squamous part contains the zygomatic process. So this particular part contains the zygomatic process, which projects anteriorly to form the zygomatic arch. Remember how I said there was an arch, right? This is a zygomatic bone. This is an arch between the two. Connects to both. The squamous part contains zygomatic process, which projects anteriorly to form the zygomatic arch with the zygomatic bone. Mastoid, a smooth pyramid-like bone located behind the ear at the base of the skull. The mastoid process provides an attachment point for muscles in the head. The middle of infections that go untreated can spread into the mastoid air cells, causing a painful inflammation called mastoiditis. Alright, so mastoid, a smooth pyramid-like bone located behind the ears at the base of the skull. So the temporal bones are also protecting mastoid 5 because there are heavier chances of inflammation. Petrous, a wedge-shaped bone that contains the otic capsule, carotid canal, and the facial nerve. Otic capsule, carotid canal, and the facial nerve. Right. Tympanic. The tympanic ring surrounds this particular. Tympanic ring surrounds the external auditory opening, which leads into external auditory meatus of the external ear. All right. So meatus, the passageway to the external ear. Stylo process located immediately underneath the opening to the auditory meatus, right? Sphenoid bone, right? Sphenoid bone is called the keystone of the cranial floor because it articulates with all the other cranial bones, holding them together. So this green colored is a sphenoid bone, right? This is superior. This is an anterior view of sphenoid bone. This is superior side, and this is the inferior side, right? That is a lesser wing. That's a greater wing. Superior orbital fissure. Fissure right here. The slit or an opening is a fissure, right? We just read that. This is the body. This particular area is the body, right? Pterygoid processes. Any protrusion or process. This is a pterygoid process. Foramen rotundum. Remember how I said foramen rotundum is nothing but a little hole where the arteries, nerves, actually come out of, right? So this is a foramen rotundum. Sphenoidal sinus in the body. So this is a sphenoidal sinus. This is optic foramen or optic canal, right? All right, so it helps form the base and lateral sides of the skull in combination with the orbital floor. Its many articulations with other bones give the skull rigidity. It is an attachment site for many of the muscles of mastication. Mastication is a noun which means to chew. All right, so this, as you can see, the green portion is a sphenoid bone. All right, the lesser wing, tuberculum sale. Tuberculum sale. Sale means a saddle, right? Like you saddle on the horses, right? Hypophyseal fossa, dorsum sale. Right? This whole thing together is called a sella turcica, right? Turcica, however you want to call it. Right? The sphenoid bone looks like a butterfly, right? As you can see, butterfly. It connects all the cranial bones. It's a keystone bone, right, of the cranial floor. All right. So let's go in detail. Optic canal, we just read all that. Sphenoid bone shares a close anatomical relationship with the pituitary gland. Pituitary can be accessed surgically through the sphenoid bone and the sinus, right? We just saw the sinuses. This type of surgery is known as endoscopic transsphenoidal surgery, ETSS, and is the approach of choice for pituitary adenomas, right? It allows for the surgical management of pituitary pathology without the need for a more extensive craniotomy, right? So that's a nasal cavity, that's a hypophyseal fossa. This is sphenoidal sinus right here. This is sphenoidal sinus. Sphenoid bone is a butterfly-shaped bone at the base of the skull that helps the eye socket. Sphenoid bone has a central body, two lesser wings, two greater wings, and two pterygoid processes. The body is cubical and contains the sphenoid sinuses. The lesser wings are triangular and spread outward from the superolateral part of the body. The greater wings spread upward from the lower part of the body. Location. Sphenoid bone is the midline of the cranial cavity, posterior to the frontal bone, but anterior to the occipital bone. Right? It's posterior to the frontal bone, but anterior to the occipital bone. You see that description, right? So it's posterior to the frontal bone, it's behind the frontal bone, but it's also anterior to the occipital bone, all right? It's in front of the occipital bone, but behind the frontal bone, right? Function. The sphenoid bone helps connect the neural cranium to the facial skeleton and provides rigidity and stability to the skull. It also contains two large sinuses that produce mucus to keep inside of the nose from drying out. So it has a very important function. Right? Openings. The sphenoid bone has several openings that allows nerves and blood vessels to enter and exit the cranial cavity. This includes the superior orbital fissure, the foramen rotundum, the foramen ovale, and the optic canal. All right. Sella turcica. All right. The upper surface of the sphenoid bone forms the sella turcica, which houses the pituitary gland. Right. We just saw why it's so important. ETSS. All right. Okay. A black eye is a bruising around the eyes, commonly due to an injury to the face rather than the eye injury, right? There's a frontal bone injury. In response to trauma, blood and other fluids accumulate in the space around the eye, causing the swelling and dark discoloration. One cause might be a blow to the sharp ridge just superior to the supraorbital margin, right? Fractures the frontal bone. This is a frontal bone injury resulting in bleeding. Another is a blow to the nose, right? So let's say, boxing, you punch, right? Certain surgical procedures, facelift and eyelid surgery, jaw surgery, nasal surgery, can also result in black eyes, right? If you look at rhinoplasty videos, you will see some sort of black eyes or, some form of presentation where you can actually see there's an injury to the supraorbital region. The periorbital hematoma, commonly called a black eye or a shyenia, associated with boxing or stick sports such as hockey. Hematoma is like the clotting of the blood, right? Which is like a defense mechanism for our body to make sure that the blood does not flow, unless you have a hemophilia issue, it shouldn't be a problem. Is bruising around the eye commonly due to an injury to the face rather than to the eye? The name refers to the dark colored bruising, which is a result of accumulated blood and fluid in the loose of areolar tissue following a blow to the head, right? So the name refers to dark colored bruising, which is a result of accumulated blood, the hematoma that we just talked about, fluid in the loose areolar tissue following a blow to the head, all right? So it is actually a frontal bone injury and not the eye injury. Remember? Okay. Let's talk about the facial bones. Very important bones. We all love our face, and facial bones play a very important role, right? So there are 14 facial bones, all right? A pair of maxilla, a pair of zygomatic, one mandible, two nasal, two palatine, so a pair of palatine, inferior nasal concha, a pair of lacrimal, and just one Vomer, right? All right. So you also have a mnemonic for facial bones. My mandible chews 9 very large zucchini pizzas, right? This is your zucchini pizza, right? All right, so this is a pair of nasal, a pair of lacrimal, the one in blue. This is inferior nasal concha, the one in green. Two maxilla, the pyramid shaped, right? Two maxilla, we just saw that. One mandible, the jawline, right? If you're a supermodel, you have a perfect jawline, or you're a gym fanatic, you have the perfect jawline, right? This is Vomer. This particular is Vomer. This particular. Zygomatic are cheekbones. That's where you put your blush. If you like putting your blush or you like wearing your blush, that's where you apply the blushes, right? This is the palatine bone. This particular red bone is a palatine bone, right? All right. As you can see, the facial bones, they have the perfect structures. Why do they have it? Because they make sure they go to gym and they exercise their facial bones. All right. So that's why they have. As you can see, Superman has a perfect jawline. As you can see, Margot Robbie has a perfect jawline. This is a zygomatic bone, right? This particular bone inside her is the Vomer, and you don't see it. I see it, right? This is a nasal concha, inferior nasal concha, right? This particular here is a palatine, all right? 1 and 2, nasal, all right? And lacrimal is somewhere on the inside, but you can see it. It's right here, right here. You know where? That's when you cry and your tears go down, right? And this, as you can see, the pyramid on Margot Robbie is maxilla, right? As you can see here too, perfect maxilla, perfect jawline. You can actually see he has 2 nasal, all right? There you go. And this is me. This is my jawline. This is 2 maxilla, right? And this is the zygomatic bone. That's where I wear my blush, all right? This is these are the 2 nasal conchas right here, and that's the lacrimal. I don't like to cry, but that's my lacrimal, right? Here, right here is a palatine, and 1, 2 is nasal, right? Right, Vomer. I personally love the mandible. I love the jawline. That's me with the perfect mandible, perfect jawline. What do facial bones do? Providing a structural framework for the face, supporting the soft tissues of the face, head, and neck, protecting a part of the brain, encasing and protecting sensory organs such as the nose, eyes, and tongue, allowing for the passage of neurovascular structures. It is like an encasement and protection of sensory organs such as nose, eyes, and tongue. So it plays a very important role. All right. What's a maxillae, right? The maxilla or maxillary bones, they're a pair, right? Are a pair of bones that form the upper jaw and most of the mid-face. What do? They provide support, right? Maxilla provides structural support to the skull and face. They also form the floor and lateral wall of the nasal cavity, which is important for breathing and warming and humidifying air, right? As you can see, this green area, this is all maxilla. Look at the maxilla here. It covers the whole face, right? It looks like a little blouse, like a top. Teeth. The maxilla hold the upper teeth in place and are necessary for chewing and speaking. Sinuses, right? There are sinuses. Maxilla contain maxillary sinuses, which lighten the skull, increase the resonance of speech, and help humidify the air. The sinuses also produce mucus, which helps with the immune defense. The facial architecture, it helps with the architecture, it helps with the framework. The maxilla separate the nasal and the oral cavities and define the face, right? Protection. The maxillary sinuses act as a crumple zone to protect vital structures in the event of facial trauma. Weight. The maxilla make the skull less heavy. Voice. The maxillae increase the volume and depth of your voice. Maxillae develop from around the 6th week of gestation and continues to develop until a person is between 14 and 15 years old. And that's why, the kids that we see at 2nd or 3rd year, right, they have a completely different structure of maxillary bone when they turn 14, 15, right? You can see the facial structures changing. The mandible, right? So this is the mandible. Mandible is the largest and the strongest facial bone. These are condylar processes. That's a mandibular notch. That's ramus. That's angle. As you can see, there's an angle. This is the body. Mental foramen, nerves, arteries, and vessels pass through it. Alveolar process, that's a mandibular foramen, and whole again, right? This is the mental foramen. Here is a mandible foramen. And again, this is the coronoid process. This is the condylar process. This is the coronoid process, right? So mandible, a venom has a perfect mandible. Look at that, right? This is perfect mandible. Movement. The mandible is the only movable bone in the skull, and it opens and closes the mouth of eating, speaking, and facial expression. Provides support. The mandible holds the bottom row of teeth in place and gives shape to the lower face and the chin. Protection. The mandible protects the face organs. It chews, of chewing. Mandible's primary function is mastication or chewing. It provides insertion surfaces for the muscles used in chewing. The joint. The mandible forms a temporal mandibular joint with the temporal bone on either side. Nerves and blood vessels. The mandible contains nerves, some of which connect to the teeth, and blood vessels. The mandibular foramen protects its vital structures as they travel to the skin, bone, teeth, gums, and muscles and tissues. The mandible is the strongest bone in the human face. Health issues with the mandible are often related to fractures or dislocations caused by trauma. Corrective surgeries can also be performed to correct the misalignment, right? Mandible is the strongest bone in the human face. Health issues with the mandible are often related to fractures or dislocation caused by a trauma, right? So it can be a punch, like a boxer's punch, or it can be a misalignment, There's something called as temporal mandibular dysfunction, right? So that's when you actually can feel that your mandible cannot close, it stays open, right? Or it's on the sideway or something like that. Nasals, we have pair of nasal bones. Nasal bones from the bridge of the nose and the external surface of the nose, protecting the nose. The nasal bones protect the nasal cavity from the external factors and protect nerves and arteries from the damage. Supporting the nose, the nasal bones support the nasal septum and the bony vault, which is the thickest part of the nose. Binding cartilage, the nasal bones bind together the cartilage that gives the nose its shape. Providing strength, it provides strength. Nasal bones provide strength to the nose, which is otherwise supported by flexible cartilage. The nasal bones are a pair of oblong bones located in the upper middle area of the face between the maxillary bones. They are fused with the skull and can vary in size and shape from person to person. Lacrimal, so tears, right? This is where the lacrimal bone is. This is where when we cry, that's our tears well up, right? That's the nasal bone at your lacrimal crest, fossa of lacrimal sac, posterior lacrimal crest, lacrimal bone, right? The lacrimal bone provides structural support for the eyes and the lacrimal apparatus, which is the tear-producing system of the eye. Nasal lacrimal canal formation. The lacrimal bone helps form the nasal lacrimal canal, which drains tears from the eye to the nose. The lacrimal bone's posterior lacrimal crest creates a depression in the bone surface called the lacrimal sulcus, which helps form the nasal lacrimal duct, right? So lacrimal sulcus is very important. Lacrimal sac housing, that's where the lacrimal sac is, right? Where tears collect when there is excessive tearing. And this is where the tears actually collect because you're very sad and you want to cry, etc. Orbicularis oculi muscle attachment. The lacrimal bone provides an attachment point for the orbicularis oculi muscle, which closes the eyelids and helps drain tears. The lacrimal bone is the smallest and most delicate bone in the face, about the size of a fingernail. The name comes from the Latin word lacrima, which means tear. So lacrimal bone is the smallest and the most delicate bone, mandibular being the largest, right? About the size of a fingernail. So it's just the size of a fingernail. Palatine bone. Alright, so this is a palatine bone. Pair of palatines. Two palatine bones coming together, and this is the pair of palatine bone. Right? So this is palatine bone. Kind of looks like a drone flying, right? Palatine bone's shape helps define the lower wall of the cranium and carve out important structures in the head. Palatine bone forms the roof of the mouth or palate, right? Palatine bone extends superior to form the walls of the nasal cavity. Palatine bone forms the lower portion of the eye sockets or orbits. Articulates with other bones. The palatine bone articulates with 5 other bones: the maxilla, sphenoid, ethmoid, inferior nasal concha, and vomer. It forms the pterygopalatine and pterygoid fossae. The palatine bone contributes to the skeletal framework of the pterygopalatine and pterygoid fossae. Forms inferior orbital fissure. Palatine bone contributes to skeletal framework of the inferior orbital fissure. The palatine bone is located between the maxilla and pterygoid process of the sphenoid bone. It consists of 2 plates, a horizontal plate and a perpendicular plate that are set at right angles to each other. Right? So one's a horizontal, one's a perpendicular, and they're actually at right angles to each other. They come together, right? So this is pyramidal process, the posterior sphenoidal process, orbital process, and this is the conchal crest, right? So this is how a palatine bone looks like on our face. Anterior, and there's a lateral view, right? This is the palate of the mouth. Inferior nasal conchae Or inferior turbinate, they call it turbinate too, right? So it looks like an X, right? Okay, this is particular thing, this is like a mass. Inferior turbinate hypertrophy presenting as bilateral nasal masses in pediatric patients, right? As you can see, bilateral nasal masses. This is a hypertrophy, right? Filtering and humidifying air. Inferior nasal concha's curved, shelf-like shape increases the surface area of nasal cavity, which helps to warm and humidify the air we breathe. Regulating airflow, the inferior nasal concha swells and contracts to maintain the right amount of moisture in the nasal cavity. This process is called as nasal cycle, and it alternates between one nostril being more open than the other. Immune surveillance. The inferior nasal concha is the first part of nasal cavity to come into contact with the outside air, so it's important for detecting pathogens. Cells in the inferior nasal concha can trigger immune responses when they detect potentially harmful particles, right? So if they detect it, they will trigger immune response, right? So this is the inferior nasal concha, right? Maxillary sinus is maxilla. This is the palatine bone here, very small. Ethmoid bone, and this is lacrimal bone. This is where the nasal concha is. It looks like an X, right? The inferior nasal concha acts as a buffer to protect the sinuses from pressurized airflow, right? Now, if you have a hypertrophy, as you can see here, it may also cause issues with airflow, right? Because it's hypertrophic. Inferior nasal concha is a scroll-shaped bone that's located in the lateral wall of the nasal cavity. It's usually about the length of a little finger, but it can be as long as an index finger. All right, so it can be a pinky finger or the index finger. Vomer. What is a vomer? Vomer actually looks like an eagle's beak, right? This is a vomer. Perpendicular plate. This is posterior border. This is nasopalatine groove. All right, so this is a right lateral view. Right lateral anterior view, and this is posterior. Alright, as you can see, it looks like a beak from the posterior side. Right, so this little thing, that is a vomer, right? Vomer's bone main function is to help support structure of the nasal passages and face, and to divide the nasal cavity in two. The vomer bone runs down the middle of the visceral cranium, helping to support the structure of nasal passages and face. Divides nasal cavity, the vomer bone, along with the perpendicular plate of ethmoid bone and the nasal septal cartilage, forms the nasal septum, which divides the nasal cavity in two. Provides passageway for nerves and vessels. The vomer bone provides grooves for the passageway of the neurovascular structure of the nasal cavity. Contains vomeronasal organ. The vomeronasal organ is embedded at the base of the septum on the vomer bone. In humans, the vomeronasal organs are prominent in fetus but show a vestigial appearance in adults, right? In humans, the vomeronasal organs are prominent in fetus but show a vestigial appearance in adults, all right? They are much more prominent in the fetus, all right, but show a vestigial appearance in adults. It looks like a more sophisticated version of a fetal version. All right. The vomer bone is a small, thin, plough-shaped bone that is located along the midline between the right and left nasal cavities. It articulates with the sphenoid bone at the spheno-vomerine suture, the ethmoid bone, the maxilla, and the palatine bones. Alright, the zygomatic bone. The zygomatic bone is, like I said, cheekbone. As you can see, this red area on the skull is a zygomatic bone, right? This is the zygomatic bone. This particular area on Angelina Jolie, this is a zygomatic bone. Zygomatic bone is also known as cheekbone, has many functions. Provides structural support. Zygomatic bone provides structure and shape to the face and forms the prominence of the cheeks. It makes it look very prominent. If you did not have a zygomatic bone, it will look flat. Okay. Zygomatic bone protects the nerves, blood vessels, and organs beneath the face. Zygomatic bone provides an attachment to the point for muscles that help move the jaw. The masseter muscle, which is a major jaw adductor, originates from the zygomatic arch, right? So zygomatic arch right here, right? The zygomatic bone connects the facial skeleton to the cranial bones by joining the maxilla to the temporal and the frontal bones. So it joins the maxilla, this particular, to the temporal and to the frontal bones, right? Force absorption. The zygomatic arch absorbs and dissipates traumatic forces away from the cranial base. Zygomatic bone also plays a vital role in maintaining the aesthetic beauty of the face, right? So aesthetic beauty of the face is very important. Zygomatic bone is important for determining phylogenetic relationships. Zygomatic bone is a stationary bone that doesn't move on its own, but it does allow for movement in other bones that are connected to it. The lower portion of zygomatic bone joins with the jawbone, which allows the mouth to move for speaking, chewing, and or other functions. The nasal septum. What is the nasal septum, right? Structures that form the nasal septum are the perpendicular plate of the ethmoid bone, the vomer, and the septal cartilage. This is the sagittal plane, as you can see, right? This is the view. That's where we are looking at. That is a crista galli. This is a frontal bone. That's a nasal bone. That's a palatine process of maxilla. This is horizontal plate of palatine bone. This is the vomer. Septal cartilage. As you can see, this is the septal cartilage. Perpendicular plate of ethmoid bone. Right? Nasal septum, sphenoid bone. This is where the keystone bone is for the cranial flooring. That's crista galli, right? We saw that ethmoid bone was stuck like this, like a trident. This is the tip of the ethmoid bone. Right? That's a nasal bone, pair of nasal bone, right? So this particular area is nasal septum, right? Perpendicular plate of ethmoid bone. This is a septal cartilage and vomer. As you can see in the picture of Marilyn Monroe, you can see, a surgery being done right here. As you can see, that there is a nasal septum surgery. The nose cartilage is changed. There is a little bit of rhinoplasty right here. The nose cartilage is changed. All right, so there might be a septal cartilage that was changed. There's a very good chance that this area was changed. The perpendicular plate of the ethmoid bone was changed. Okay. More than that, I think it's a septal cartilage change. This is more wide. This is more, how do you call it? It looks more smaller than wider. This is very wide. This is perfect, sharp. All right, so I see a little bit of sharpening here. And that can be the septal cartilage. And this area is the nasal septum. Okay? Okay. Paranasal sinuses. Paranasal sinuses are mucous membrane-lined spaces in the frontal, sphenoid, ethmoid, and the maxillary bones that connects to the nasal cavity. So that's the frontal sinus, ethmoidal cells of ethmoidal sinus. That's ethmoidal sinus. And this is a sphenoidal sinus. Sphenoid has a sinus. Maxillary sinuses, right? This is a sagittal plane, as you can see. Sphenoid sinus. This is a hypophyseal fossa, right? Frontal sinus is a frontal sinus right here, right? It's right here. When you have cold, this is where actually you will feel the most pressure. You'll feel like something's hurting there. It's a very good chance there's a mucus formation, right? Sphenoidal sinus. At times you will also have a pain around your sphenoid area. You'll be like, oh my god, my sinuses look real hollow. You can actually see an enlargement of the sinuses in x-ray. Usually you don't, but in certain cases you can actually see enlarged sinuses. That's when you know there's some sort of sinusitis that's going on, right? All right, foramen, right? Carotid. These are facial foramens, hypoglossal, infrajugular, lacerum. We already spoke about it, right? But all these are related to facial bones. We have already discussed them. Alright, so thank you for watching. If you like this video, like, subscribe, comment, and share with your friends and family. Facial bones and cranial bones are a very important part of the skull. They provide structure and framework. Hopefully, after watching this video, you will be very conscious in taking care of your facial bones as well, not only just the skin. We focus more on skin and not on the inside, but understand that your framework defines your facial features. Right? It's not too late. Doesn't matter what your age is. You can still provide a facial structure. You can do either weightlifting, you can go to gym, you can walk, you can do cardio. Weightlifting has a very strong impact on our facial bones. You want to try doing that. Okay? All right. Thank you. Bye.